heart condition that may be more common than you think.
I have a leaky valve in my heart where the blood can flow in the wrong direction. Sometimes my palpitations are so intense that it feels hard for me to catch my breath.
Sometimes we need a little extra attention and help when it comes to specific medical issues. And that's why today we're giving you answers straight from the specialists. And right now we welcome cardiothoracic surgeon, Dr. David Gruner. So good to have you, Dr. Gruner. So this question is one I know you're going to love tackling, so let's take a look.
2 years ago, I was diagnosed with mitral valve prolapse. And what that means is that I have a leaky valve in my heart where the blood can flow in the wrong direction. Sometimes my palpitations are so intense that it feels hard for me to catch my breath. I'm worried that my condition is getting worse. I'm wondering how you know when you need surgery.
That was Connie. She was actually going to be with us here today, but she's been experiencing some symptoms. Connie's on the phone instead. Connie, can you hear us?
Yes, I can hear you, doctor. Thank you for having me.
Well, we're so sorry that you're not feeling well. What kind of symptoms have you been having?
I've been experiencing some dizziness and weakness.
And let's talk about this, Dr. Gruner. Let's first of all talk about what mitral valve prolapse is, and then, of course, talk about symptoms that you may have, certainly Connie representing someone who is having symptoms.
So we have a greater than life-size schematic here.
Is that bigger than a normal heart?
My heart's pretty big, but this is just ridiculous. Okay, so the heart has two sides, the right side and the left side, and 4 chambers. The right side is separated by the tricuspid valve, and the left side is separated by the mitral valve. The right side pumps blood to the lungs. The left side gets oxygenated blood after it's oxygen-rich and pumps that blood back into the circulation. In mitral valve prolapse, the mitral valve is bulging for some reason, usually because of what's called degeneration of some sort. And the valve is essentially more parachute-shaped than normal, and at some point it can leak. You essentially have a backflow of blood into the lungs, and it basically floods the lungs, so you're essentially getting some sort of a drowning phenomenon. This doesn't happen in every patient. The majority of patients with mitral valve prolapse will never need surgery and will never have major symptoms. It's just an anatomical finding.
So it's a one-way valve, but in some people, that one way doesn't work perfectly.
Correct. And it becomes a two-way valve.
When does someone potentially need a cardiothoracic surgeon to evaluate whether or not a surgery might be necessary?
That's a complicated question, you know.
In 5 seconds or less.
Exactly.
I'm just kidding, of course,
really
because it is complicated.
Yeah.
But is the big thing here, if you're starting to have symptoms, that you need to be watched carefully?
Yeah, the general recommendation is to have an echocardiogram, which demonstrates both the function and the form of the heart every year. Most people will be recommended to take antibiotics for even minor procedures like colonoscopy, like dental work, things like that, that normal people with no valve disease would not take antibiotics for.
And the reason for that is if you're having a procedure done and that bacteria gets in your bloodstream, if you have a defect with your valve, it can seed that valve, leading to further complications.
Yep.
And Connie, you are in the care of a specialist for this, right?
Yes, I am.
And I think the takeaway here is that mitral valve prolapse can be quite common. Most people don't have symptoms. You need to, if you're having symptoms you described of heart failure, the types of symptoms Connie's having, it's not normal to go around feeling dizzy and short of breath all the time. Get an evaluation. Connie, we wish you the best of luck. We hope that you're feeling better.
Thank you, Dr. Travis.
And Dr. Gruner, thank you for the great work that you do.
Yeah.
Keep people healthy out there. And coming up, if you do dread going to the dentist, we have a new solution that will have you ready for the dentist chair in no time at all. And then later, the sign of a serious health problem, but you'd never expect it.